You're listening to Civic Media. You can tune into any of our live shows on any radio station across the state with the Civic Media app. Find us in your phone's app store and listen anytime, anywhere.
Welcome to the Dr. Kristen Lyerly Show. I'm Dr. Kristen Lyerly, and today I am thrilled to welcome a remarkable colleague and friend, Dr. Anita Bublik-Anderson, an obstetrician, gynecologist, and family medicine doctor, and so much more, who is doing something truly transformative for women's health in Wisconsin. She is the engine behind a brand new, groundbreaking menopause and sexual health clinic in Wausau, of all places, filling a critical gap in care that has left countless women struggling in silence. And as a breast cancer survivor herself, and we're recognizing Breast Cancer Awareness Month now, she brings both professional expertise and deeply personal understanding to this work. For way too long, menopause has been treated as something that women should simply endure quietly, like it's not a significant health transition for us, affecting half of the population. We deserve comprehensive medical attention for this. If we're lucky enough to hit age 50, this is our destiny. And it's not just hot flashes, it's cardiovascular health, it's cancer, it's bleeding, it's mood, it's so much more. And the lack of education, the shortage of trained providers, and the political interference in evidence-based medicine have all created a crisis in women's midlife healthcare. But change is happening. From Hollywood to Capitol Hill, advocates like Halle Berry are joining physicians like us to demand better. We're fighting for federal funding, improved medical education, and accessible care. We're breaking the stigma and we're breaking the silence. And that's what today's conversation is about. It's more than just menopause care, more than just sexual health. It's about how we're reclaiming women's health from the shadows of medical neglect and political manipulation. So let's dive in. Anita, welcome to the show.
Hey, Kristen. Thanks for having me. I'm so excited to be on your show. This is great.
I am so excited for what you're doing because you are a Wausau gal. You were a practicing OBGYN doc delivering babies when breast cancer struck. And your journey has really created this opportunity for you. Tell us about it.
Yeah, it really has. I was living the dream, raising 3 small children and full scope OBGYN practice, robotic surgery, lots of babies. And then it all came to a screeching halt when I found a mass in my breast and my mammogram had missed it 5 months earlier. And that, set me down that path of, kind of crossed over from physician to patient and became very well acquainted with oncology and surgery and plastics and oncology and like the whole thing. And, so I stopped practice so I could undergo chemotherapy for 6 months and then had a bilateral mastectomy and then radiation after that. And then a reconstructive surgery, which in and of itself was extremely, probably almost the hardest part of the whole thing was like my recovery from that because it was a very long surgery and so much that I wasn't even aware that I was going to be experiencing as a result of this surgery. So it was really interesting because I'm like, wait,
you take care of women. Like you would think that you would have a better idea, but you were young and you had little kids at home.
I did.
And so there you are in the middle of this.
Yeah, it was really, really hard. My youngest was in kindergarten and I was 45 years old. So, and I'd been having routine testing since I was 35 and never picked up anything. So I'm really thankful that I was able to, find that mass because I don't think I would have made it to my next mammogram because this was a triple negative breast cancer, particularly aggressive. And, it was pretty tricky. But I had like a rock star team through Mayo Clinic that I was working with. So grateful that I landed there.
This is a great opportunity for 2 OBGYN doctors to remind our listeners breast cancer screening, get your mammograms, do your self-exams, just know what your breasts look and feel like.
Absolutely. That saved my life,
Yeah.
Mammograms are really important, and just knowing your body, knowing what's different. And if you feel something that wasn't there before, or it feels odd or weird, like, it needs to be evaluated. And if you're told to just don't worry about it, maybe you're dismissed, you're told like, well, maybe we'll check it out in a couple cycles. Like, don't listen to that. Find somebody else, go to a breast center, have somebody image it, palpate it, like, get it looked at. Right.
It's too important. So there you were in the midst of this really intense treatment for this very scary cancer. But then your life continued. Like, you went on. There must have been those moments where you felt like, I don't know if I have a future. But here you are a decade later.
Yeah, I really, you said, like, if we're lucky enough to make it to 50, like, I am in that category. I didn't know if I would see my son graduate from high school. And when he graduated in 2021, it was like, everybody was crying. It was really a moment. And so I just, my youngest, who was in kindergarten when this all started, I just sent her off to Madison. So I've seen her graduate too. So I'm just like, wow, this is amazing. I made it over 10 years. Like, once I didn't die after 3 years, I was sort of graduating from oncology. So, I really didn't know what to expect. I knew I couldn't go back to the life that I was living. I knew I needed to take care of myself. I needed to focus on getting better and healing, because I was just sort of thrust back into the world of the living. And being an oncology patient, it's really like you're invisible. Like, people do not see you. And they also will approach you and give you all kinds of advice, like at Menards, like, it's just like when you're pregnant, like, it's so obvious, I have a turban on, lost all my hair. And people like would walk up to me and be like, oh, you have cancer. Like, you need to drink spring water. Like, that's why you have to eat organic, because that's why you got cancer. And I was like, accosted.
Oh, really?
Like, not infrequently.
They didn't teach me that in medical school.
Yeah,
but thank you for caring.
Oh, yeah. And then, I'd be at the pharmacy and the picking something up. And then the pharmacist who knew me because they filled my prescriptions that I wrote for my patients. Yeah, I heard you had cancer. Oh, I knew so-and-so, my relative, friend, whatever. Oh, and they died. Like, I heard that so many times. Oh, I knew somebody who had that cancer. Oh, and they died. It's like,
wow.
Thanks. I guess, like, what do you do with that?
Yeah.
So, if you know somebody that has cancer, don't say that to them.
Common sense would dictate support is what you need. And you had a lot of support. And you went from having a crazy life, like being an OBGYN doctor, having 3 little kids, going all the time. You're not taking care of yourself. You can't. There's not enough time. But you went from that to being invisible to now.
Yeah.
What did you learn from having been on both sides of it?
Yeah.
That set you in this direction to open your own menopause clinic and sexual health clinic? This is a huge undertaking, but man, do we need you.
Yeah, I'm so happy to be here. Like, okay, so I went from invisible and really dismissed. Even I would go with concerns. I have 2 daughters. Like, what do I tell them about how do they stay healthy? And then I saw changes to my blood work that I was concerned about. And I saw my thyroid, it was trending up. I saw my blood sugar trending. I'm like, is this a menopause? Because I was thrown into menopause from the chemotherapy. And I was like, what is this metabolic? What's going on? Well, then just don't worry about it. Like, you don't meet criteria for diabetes yet. And you don't need to monitor your blood sugar. It's fine. Like, go live your life. Your hair grew back, And it was like, well, how do I do that? How do I live my life when I don't know am I going to be here in 2 years? Like, so
like you're checking off their boxes, but you're not feeling like you are being taken care of as a whole person, and you're seeking more answers.
Right. And I just was extremely anxious, very depressed, like changes to my body, just disconnected from like who I was and where am I now? Where am I going? And so that was a struggle. And so I started listening to podcasts like yours. I started, reading articles. I started looking into other, avenues. I was investigating functional medicine. I did a fellowship in integrative medicine and went to conferences. I went to the Ishwish conference and I landed there and I was like, these are my people, like all about women's health, listening to them and validating and like what their concerns are and what it's like to live in an environment where medical research isn't being done. I was like, oh, this sounds so familiar. Like, I know this and I know I can help people. So I got to a point where it was like, I was so compelled that I couldn't like not go back into patient care because it's been 11 years. I've been teaching and just kind of doing all this learning and thinking like, well, I could help them. Like, I know I could do something. I could do this. And like, oh, maybe this person could use something like this. I could help them. And I was like, well, I guess I have to do this now.
Yeah, because both your knowledge and your experience brought you to this point.
Mm-hmm. Yeah. So I came out the other end and I was thinking about it for a couple years and just decided it was time.
So what kinds of services do you offer at your clinic for our listeners who are thinking, oh, me too? Because there are so many of us. I mean, 1 in 8 women in this country will have breast cancer in her lifetime, but everybody who lives through menopause will have menopause. So, and if you go through menopause, it's likely that you'll have some sort of an experience that you'll be seeking information. So what do you offer?
Yeah, so I'm focusing on, women in this transitional time of, peri and menopause, which can last years. Perimenopause can last years and that whole transition. So I wanted to create a place where stories are heard, where I believe them, where I have the opportunity to provide different avenues for managing all the symptoms of perimenopause and menopause from like a functional integrative medicine sort of informed mindset, if that's what they're into, or like other medications like hormone replacement therapy, and if it's and I'm rather new to the sexual medicine sort of field, but I'm connected to like sex therapists, to pelvic floor PT that like specialize in women with a lot of concerns with pelvic floor. So I can refer, and I'm continuing to like learn and understand how to navigate, because a lot of this I wasn't covered in residency.
Oh, none of it's covered in residency.
None of it.
We have to talk about that too.
Yeah, and like my CME, there's been a little bit of sexual medicine like recently, and maybe a little more on menopause, especially in this past cycle for 2024. I like more articles surrounding it, but it's not mainstream information, and women are just desperate to be heard and listened to.
They sure are. I think that's the most important thing, is building that trust with your provider and really feeling heard, and then knowing what your options are. And that's exactly what you are providing at Pause Medicine. I don't think we said it. Pause Medicine. I'm talking with Dr. Anita Bublik-Anderson. She's got a new clinic in Wausau that offers menopause care, sexual wellness, and lifestyle medicine. And when we come back, let's talk a little bit more about what kind of information we get in training and why this deficit exists. You're listening to the Dr. Kristen Lyerly Show on the Civic Media app and all across the Civic Media Radio Network.
You're listening to Civic Media. Stay up to date on the latest news and information for your local community and Wisconsin by signing up for our free email newsletter. Visit civicmedia.us/email to get started.
Welcome back to the Dr. Kristen Lyerly Show. I'm Dr. Kristen Lyerly, and I'm talking with Dr. Anita Bublik-Anderson. She is just starting a sexual health and menopause clinic in Wausau, Wisconsin, because it's based on her own personal experience. She's a breast cancer survivor, and she knows what it feels like to be experiencing all of these terrible symptoms and not have anywhere to turn. So this is an incredible resource, not just for the women of Wausau, but the women of Wisconsin. And Anita, we're so excited to have you here today to talk about this. In the last segment, we talked a little bit about medical education. This is your bread and butter. You've been teaching medical students now for over a decade. When I was in medical school, we got about 30 minutes on menopause and an hour on menopause. You got probably nothing.
I have no memory. I have no memory of anything in medical school related to menopause. I mean, it would have been in an endocrinology unit, maybe in like first year, maybe second year.
That's a long time ago.
This was like 1994. So, it was a while ago. But I don't remember anything. And I certainly don't remember anything in my family practice residency or my OBGYN residency.
Which is shocking.
Neither. And then all the CME we've done, you and I have to do every year.
Continuing medical education. Yeah.
Yeah. There's been very little up until recently. There's been some really nice articles in 2024 that I selected.
Yeah, I think that there have been more because of the big push by people like Halle Berry, who has stepped up and made this so visible. And sometimes because, you were saying earlier that menopause has been living in the shadows and we haven't been able to talk about it. But when somebody like Halle Berry starts talking about these things, and it just gives the rest of us permission to talk about it and to share our experiences. That is huge. What do you think about this kind of high profile advocacy and what it means for the future of Pause, your new clinic in Wausau?
I love it. I think the more visibility that, people with a voice have to speak out and say, to just make this like normalized, like, guess what? Women age, and we live beyond our reproductive potential. And like, I definitely am, and so we're worth paying attention to. We demand to be paid attention to and taken care of and like get the things that are going to improve our life. I think we've been denied that for so long.
But women can pound their fists as much as they want to, unless physicians are listening.
Right.
It doesn't matter. Unless healthcare providers hear us and have options for us, it doesn't matter. So we have a role to play here in advocating for change and making sure that these services are available.
Yes. And there are so many organizations like ISHWISH, like the Menopause Society, like ACOG is kind of getting there. There's just more information out there that is current. That, there's a big campaign that Rachel Rubin is behind to like change the black box warning that's on every single estrogen product in this country, despite how it's administered, despite its dose, or like how it's made. And so that was like over the summer, I think. And I hope they're going to look at that. And so as many people as we can to get involved, to realize that this is important and it's costing lives. Women as we age, hip fractures and urinary tract infections, like even vaginal estrogen has a black box warning, and it's like it's so safe.
The black box warning
should use it.
It doesn't reflect what's actually happening with the product. And we've got years of data to back it up. But for some crazy reason, that warning stays on all of these products, including, as you mentioned, vaginal estrogen, which we commonly use for one of the most common symptoms of menopause, which is vaginal dryness and sexual discomfort. And vaginal estrogen is so easy. Even as a breast cancer survivor, many breast cancer survivors can use vaginal estrogen safely.
Absolutely, they can. The safety data is there.
Yet
it prevents urinary tract infections, which is a really common problem for women as we age, and it causes urosepsis and death. And we could save lives by taking this black box warning off and helping women with this issue as we age. Period.
Or no period, which is the definition of menopause.
That's right.
I couldn't help myself. And vaginal estrogen, we should talk about urosepsis. You mentioned that's when you get a urinary tract infection and then it ends up going into your bloodstream, and it can be deadly, especially for older women. So there are so many reasons why, if you are having a problem with those parts that are kind of unspeakable and hard to talk about, it's important to talk about them. They, not only could you have better quality of life and certainly better sex, but it could literally be life-saving to treat your vaginal dryness.
Yes.
Yes.
I don't know what else to say to that. It's a mic drop. Like, dang. Like...
Yes. And I definitely want to talk about your history as a breast cancer survivor and how you approach treating these really tender issues that, in my experience as an OBGYN doc, when I'm helping people who are living with this history of breast cancer or of other cancers that are considered estrogen sensitive, it's really tricky to negotiate their care with their oncologist, because some of the oncologists are not on board with using additional treatments like vaginal estrogen to help some of these common problems.
Now, this is very tricky. I will say, okay, vaginal estrogen, women can use whether or not they've had breast cancer, whether or not it was estrogen receptor positive or not. Like, the safety data is there. So when we get into systemic estrogen, so this is, probably a patch or a cream that's applied to the skin and it's absorbed that way. There are oral formulations that aren't as common, and they also have a different risk profile as far as causing blood clot, the likelihood of a blood clot to occur. So this is a very touchy situation. There are...
It is touchy, but we have to take a break. But I want to talk about this because this is like the heart of it, Anita.
It is.
So I'm talking with Dr. Anita Bublik-Anderson. She's the founder of Pause Medicine, a new clinic in Wausau that offers menopause care, sexual wellness, and lifestyle medicine. When we come back, we're going to hit that super controversial topic. You are listening to the Dr. Kristen Lyerly Show on the Civic Media app and the Civic Media Radio Network. Welcome back to the Dr. Kristen Lyerly Show. I'm Dr. Kristen Lyerly, and I am here with my colleague, Dr. Anita Bublik-Anderson. She just opened a new clinic in Wausau called Pause Medicine. They offer menopause care, they offer sexual health care, and lifestyle medicine. And a lot of it is based on Anita's own experience. Now, if you missed any of our previous conversation where we talked about cancer and sex and all the dicey things, you're definitely going to want to hear it. So tune in wherever you get your podcasts, or on my YouTube channel if you want to watch us too. We're at Dr. Kristen Lyerly. We were just talking in the last segment about all the different options for estrogen therapy. And we talked a little bit about vaginal estrogen and how really, really safe it is and how important it is, if you're having those kinds of symptoms, to have them evaluated. We're just starting to talk about systemic estrogen, which is like for your whole body. So it's a cream, a spray, maybe a pill. Hey, Anita, where do you stand on that kind of therapy, and how does that work within the context of the new clinic that you're opening?
Yeah, so my goal is to meet patients where they're at. So if they want to stay away from, there's a lot of safety data out there, but if that's something that doesn't sit well with a patient, then there are other options. There are other products that you can take to at least relieve some of the menopausal symptoms that you could be dealing with. If it's a sleep disturbance, if it's an energy thing, if it's hot flashes, there are other options out there. Some are herbal, some other things you can do to optimize your sleep. And then hormone replacement therapy in the form of, a topical like patch spray. Those are options. Some women don't like to have things on their skin. There is an oral therapy too, but that's, a little more likely to cause a blood clot, but it's certainly an option for many people.
Yeah, and a little more likely means like it's still pretty incremental.
It's still pretty rare. The oral medication is, so what was it? I don't know.
Are you talking about the Women's Health Initiative?
Yeah, the Women's Health Initiative study when that came out.
So long ago. So miserable.
It was so long ago, and it was on a different type of hormone. And this is like the whole mythology of like how we got here was the release of that study. Before it was even like analyzed, it was released to the media, and so it became this whole big controversial thing that, estrogen hormone replacement therapy causes breast cancer. And the hormone that they were using at the time was called Premarin, which is derived from pregnant horse urine. Like, guess what? We don't use that anymore.
Yeah, I think we need to back up a little bit. So the Women's Health Initiative study was a huge study, and it was intended to look at heart health, not at menopause symptoms so much.
Correct.
But what happened was when they looked at the data early on, they saw some concerning trends. So they just stopped it. And the message that the public got was hormone therapy is not safe. So that happened when you were practicing. I was in training, and it was like we didn't get any training on hormone therapy because at the time we weren't prescribing it. Doctors were not prescribing it. Patients were not seeking it. And it really forced people who were suffering. And don't get me wrong, people suffer with menopause. Some people breeze right through it and it's no problem. Other people, vaginal dryness, hot flashes, sleep disturbances, mood issues, you name it, it certainly could be perimenopause. And that's why it's so important to get it checked out, get some answers so you know what your options are.
And you might not even be suffering greatly, as you say, from all those symptoms, but maybe you want to optimize your bone health or your cardiovascular health.
Yes.
And that's why you want to be on estrogen, because or maybe your libido is decreased. So, and maybe you have some vaginal dryness. So like you can use a vaginal estrogen, and there's systemic estrogen that you can take too that can help with those things. But like for your bone health, your cardiovascular health, those are systemic types of like the patch or a spray, even the oral form that can help you with those endpoints. And like the number one killer of women, it's cardiovascular disease.
Yes.
At this age. And if women get a hip fracture, then they're more likely to die within the next year. And so bone health is so important, as is our muscle health.
Well, and a lot of us don't put those things together because you think about like hot flashes, estrogen, but really in order to have strong bones, we need estrogen to be able to maintain our bone health. We lose a lot of our bone density when we go through the menopause process, and cardiovascular health as well. So these are really, really important endpoints and things that you need to be talking with your healthcare provider about.
Mm-hmm. And I think a lot because of the shadow of the Women's Health Initiative study, all of us who trained during that time, and the fact that there's not a lot of where do you go for your information?
Right.
Where do you find this?
TikTok.
You really have to seek it out, and you really have to advocate for yourself and be like, hey, I read this, I heard this, I really want to consider this. And, can you imagine how frustrating it would be to go to your doctor, to get up the courage to go in there and ask and inquire and be turned down? No, we don't do that.
Mm-hmm. We don't do that. Just because we don't. I know. I was talking with a colleague the other day, and they were talking about a TikTok video about using mustard vaginally to treat your symptoms. I know. I was like, mustard? Ooh. That sounds don't do terrible. That. Yeah, maybe if you're having some problems, maybe just go get it checked out. But truthfully, there are a lot of people who just can't afford or can't access or are too worried, too shy, too embarrassed to admit that they're having a problem. So they do turn to social media. And that's very frustrating, isn't it?
Well, yeah. I mean, I've been out of patient care for 11 years, but I get it. I could see how it's hard to battle. We used to call it Dr. Google. But patients are informed, and it's you have to meet them where they're at and be curious. That's interesting, that you got that information. So I have some information, if you care to hear it, that, might be, if you're interested in hearing it, then okay. So you just have to kind of have an open mindset and try to understand where they're coming from, and they're there in front of you for a reason.
Right. Do you ever find that they come to you and they say, I'm really sorry, but I Googled this.
Oh, it's fine.
It's totally fine. Okay. And you know that I Google things. I mean, I don't know everything about everything.
You can learn anything on YouTube. Anything.
Yes.
You can install a, furnace.
But don't install mustard in your vagina.
Don't do that. That just sounds like a bad idea. It just sounds bad.
Can we talk a little bit about sexual health? Sure. Because I think a lot of people don't necessarily understand the relationship between sexual health and menopause care. What is the overlap there?
I think sexual health is an important part of women, basically anybody who's having sex. I mean, I think it's an important part of our life. Like, wars are fought over sex, or they like, you know,
yes, they are.
so elemental. It's just such an important part of our life. And I got zero training in this as an OBGYN. Like, I was delivering all the babies. I was preventing pregnancies. I was terminating pregnancies. I was taking care of everybody pregnant, but I got very little education on the sexual part of it. And a lot of that, I understand, happens in urology, which is typically like for men. And so maybe they're getting all the education. Like, people who are dealing in women's health aren't getting it.
Yeah, I don't know. I'm just feeling like it's not there, and people are really grossly misinformed. And, that bleeds over into a different area of our work, which is reproductive medicine, and how you look at what's happening in the abortion world and being able to access birth control and the politicization of that piece of it. It's kind of a mirror of what's happening in menopause.
It's from my standpoint, it has to do with body autonomy. So if, you are an agent of your body, and if you should be in charge of what's going in it, and who has access to it, and how you're moving through the world and your life. So I think, reproductive health is how I got into medicine to begin with. And that had a lot to do with body autonomy. And one of the greatest things what I loved about my job was that women would come to me and they'd be like, they're having crazy bleeding, and they can't wear white pants anymore, in the summer, and they just want to wear white pants again. I'm like, yes, I can help you. Or they don't want to have a pregnancy just now, but it's like, okay, let's find the right thing for you that's going to work for you, so you can live the life you want to live. And when you're ready to have a family or try to get pregnant, then let's work on that too. So, and I think in menopause, it's the same thing. How are things going? How are you suffering? How can I help you to, live with strength and vitality and intentionally? And what are your goals? Where do you want to be? How do you want to age 10, 20 years from now? Let's get on that. It's important.
So it's so important. And it's not just about, here are some hormones. It's about so much more than that. When you're treating someone holistically, what are the other major components of the kind of care that you are delivering at Pause Medicine?
Yeah, so the lifestyle medicine part of it, I think one way to just wrap everything around this big blanket of how to optimize your health. So how can you optimize your cardiovascular health, your bone health, your muscles? What's called, when you muscle waste as you get older, it's called sarcopenia. And, we'll get weaker. We'll lose cardiovascular capacity as we age, just because the clock is running. So we really have to be intentional about how we move our bodies. We have to be intentional about how we sleep and prioritize it, how we reduce stress. One of the most important things we can do is to address what we eat. And our diet is what we're putting into our body is the most important pillar, I think. And to, manage all these metabolic changes that occur as we age, as we're in menopause, to insulin resistance is more common, lipid abnormalities are more common. So you have to kind of address it in this multimodal way. But if you can move through the world and eat clean, eat healthy, lots of vegetables, and the right amount of protein, and lift weights and do your cardio, and, sleep and address your stress, and get out there in the community and, be with your people, and, contribute. I think that's just magical.
It seems so simple, doesn't it?
It does, right? It is.
I'm so glad that you mentioned the whole get out in your community piece, though, because that is a big component of our mental health. And I think especially since COVID, many people have felt isolated. We've forgotten how to talk to each other. We've forgotten how to support each other. And you need that as human beings, especially as older human beings, because that's the way that we grew up. That's what we're used to. And when we don't have that in our lives, we really suffer from a mental health standpoint.
We do. And that was something I was really intentional about in my practice is I didn't want it to be a virtual, I mean, I have virtual capacity. I can do telehealth, but I really want to sit down. I want to, be in the room with somebody. I want to be able to connect. I wanted to create a space where women can come together and not only be validated, but like share stories and like have events and like, be together, because we lost that during COVID, and it's just so important.
We need each other.
We do.
Very true. All right. When we come back, recognizing that our healthcare system is broken and chaotic and incredibly challenging both to receive and give care. Also, there is opportunity, right? Chaos creates opportunity. So, Anita, I want to hear your vision for women's midlife healthcare in Wisconsin and beyond. And I know you have a lot of thoughts about this. Yeah. All right, I'm talking with Dr. Anita Bublik-Anderson. She is the founder of Pause Medicine, a new clinic in Wausau that offers menopause care, sexual wellness, and lifestyle medicine. You are listening to the Dr. Kristen Lyerly Show on the Civic Media app and the Civic Media Radio Network.
You're listening to Civic Media. Find the latest news, information, and archives of all your favorite shows on the Civic Media website, civicmedia.us.
Welcome back to the Dr. Kristen Lyerly Show. I'm Dr. Kristen Lyerly here with my colleague, Dr. Anita Bublik-Anderson. She is the founder of Pause Medicine in Wausau. It is a new clinic that offers menopause care and sexual wellness and lifestyle medicine, and she listens. And that's amazing. We've been talking about menopause and sex and cancer, just the usual girl stuff. And when we left the last segment, I asked Anita to share her vision for the future of women's midlife healthcare, because it's been rough for us pretty much our entire lifetime as women, as providers, and our healthcare system is really broken. But in that chaos, there may be some opportunity, and that seems to be, at least in part, from where your clinic and your desire to help people is coming from.
Yeah, for sure. It took me a long time to get to this point where I am right now. 11 years after cancer, I had to just scratch my way back to health and to where I felt whole again, where I really felt like I'm like living the life that I want, and I'm like meeting my purpose, and it's helping women has been my I don't know what I went into medicine for to begin with. So I feel like I've arrived, and it took me a long time to find a doctor that would partner with me, and to give me what I needed. And
as a patient.
Yes. I got a lot of things from doctors. They saved my life. I had an amazing team at Mayo. I had excellent care. And it took me, but it also took me, I was also dismissed by many doctors for my concerns that I had, and was just told, you don't meet criteria, or this is what we have for you, or we just don't do that. And so I found somebody that I was able to partner with, and that's worked out really well for me, but it took me a long, long time. Mm-hmm. And I just I wanted to be a resource so that women, I'm pretty resourceful. I got my way through medical school and where I am today. And I just didn't want women to have to fight so hard to find somebody who would listen to them. But my dream would be for women to kind of be able to tune into their body and meet with somebody who would be curious, who would listen, who would partner with them and go on this journey together to like hold their hand and be like, maybe I don't have all the answers right now, but I'm willing to like look around and listen to what you have to say and give you my opinion and maybe think about like some other way if that's what you think would work better for you. And I think partnering with a patient, I think that's what this is all about. It's about meeting people where they're at and hearing them and kind of respecting their place of where they are. We can be a resource. We can help educate also. That's a lot of what we do in medicine. I mean, especially around pregnancy, because like if you've never had a baby, like it is like unknown territory if you've never had a kid. Like
it's a journey.
It is. It's wow. Yeah. You know, and like parenthood to begin with. I still have a teenager. So like that was a whole, raising teenagers is challenging.
Just like everything else, like when it comes to your body, like everything is evolving. And that's why you need a partner and you need somebody who will advocate for you and teach you how to advocate for yourself. So in the waning moments that we have together, what message do you want to leave with our listeners about menopause, sexual health, and the importance of being able to advocate for yourself when you're not finding what you need and you've got to figure out how to get by, how to be treated like a whole human being?
Yeah, I wouldn't stand for, I would want women to know that they don't need to suffer, that they don't need to like be dismissed or turned away. Like if they're experiencing that, then they need to keep looking. They need to keep searching for that, ask your friends, your family, like somebody in book club, like who do you see? Like this is what we need to talk about this. We need to bring it from behind the shadows and experience like what this is, like talk about it. What are the issues you're having with your sexual health? What are the issues you're having surrounding, perimenopause and menopause? Like what is that like for you? Keep searching. Don't be turned away. If it feels yucky, it probably is. Trust that feeling and know that you can, find somebody who will partner with you. Like we're out there and we're in many different health systems and towns and, like you're over in Green Bay, I'm in Wausau. Like, there are people out there that want to take care of you and will, and want to help you live well as you age and with health, vitality, and, optimize in all the ways that you can be optimized. I think like we're out there. This is becoming more of a movement, I think.
I think so too. Our numbers are growing. And I too am a menopause certified provider. But when I looked it up today, there were only 2 of us in Green Bay.
Yeah. And I'm not one of them yet. So I haven't yet done that test. I was working through different certificate programs and I'm always learning. There's more for me to do for sure.
There is more for all of us to do, especially those of us who are taking care of people from vulnerable populations, women who otherwise can't find care. Anita, where can we find your clinic online and on socials?
Sure. I'm at pausemedicine.com and my website's live. My phones just got turned on today. Yay. And I'm also on social on Facebook and Instagram. And patients can book appointments with me online as well as discovery calls just to see if we're a good fit.
Great. And it's a 15-minute free consultation, a discovery call.
That's right.
Yeah, that's amazing. Anita Bublik-Anderson, my colleague and friend, doing incredible work in Wausau, taking care of people who are suffering from menopause symptoms, sexual wellness, lifestyle medicine. Thank you so much for joining me today.
Thank you, Kristen. Such a pleasure.
Here's to the future, my friend.
Cheers.
All right. If you missed any part of our conversation, you can always find it on civicmedia.us and wherever you get your podcasts and on our YouTube channel at Dr. Kristen Lyerly. And please, we love your comments. So find me on the socials, send me a message, let me know what you thought of the episode and what you want to hear more of. Many thanks to Abraham Lyerly, our producer, and so much more, and Nick Tierman, who composed our theme song. And until next week, you're listening to the Dr. Kristen Lyerly Show on the Civic Media Radio Network.
The national news cycle never stops, but it can be hard to find news about your local community. Civic Media is dedicated to providing quality local and state news coverage across Wisconsin. With the Civic Media app, you can get notifications about local stories that matter to you and your community. Find the free Civic Media app in your phone's app store and choose notifications from the menu to tell us what kind of news you want to hear about.